Former U.S. Surgeon General Dr. Jerome Adams joins us now to talk about all this. Dr. Adams, good morning.
Good morning.
So Florida's governor says the state could withhold the salaries of school officials who defies order to ban mask mandates. As a physician, as a father, what's your reaction to that?
Well, as a physician, as a public health expert, it is deeply troubling that it seems we're letting politics get in the way of protecting our youth. As a father, I quite frankly think it's unconscionable. I really do. I think you can't tie the hands of school and public health officials based on what you perceive to be the reality when your public health officials are telling you they need these tools.
And you've said recently that this pandemic is spiraling out of control again. What do you think the next few weeks, the next few months are going to look like?
Well, we're going to see more spread, unfortunately. And today I'm touring Oklahoma University Health Center. And we're hearing that our nurses, our doctors, they are quite simply overwhelmed. We're going to see increasing hospitalizations. Fortunately, with higher vaccination rates, we're not going to see as many deaths as we could otherwise see. But it's going to be a really tough next couple of weeks. And parents, if your kids are over 12, please talk to your doctor or health provider and get your questions answered so you can get them vaccinated. You can consider wearing a KN95 or N95 mask because they're available now. And keep an eye on the numbers in your areas, the COVID numbers, so that you can make an informed decision, even if the politicians out there are telling you that they won't let it be mandated.
We've talked a lot about the impact of COVID on minority communities, too, and I want to turn now to a new report which shows an alarming racial divide when it comes to medical care, finding that minority patients are underrepresented for elective care at roughly 4 out of 5 U.S. hospitals, and that leads to worse health outcomes for people of color. This may not be a surprise to people, but there are the numbers to back it up. What can we make out of this?
Well, number one, if you're a leader of one of these top institutions, you should be embarrassed. You should be ashamed, because what U.S. News and World Report is telling us is these aren't the top healthcare institutions for Americans. They're the top healthcare institutions for white Americans. 4 out of 5 hospitals in this country are serving lower than their demographic share of Black and brown people. They're not having this equitable access to cancer surgeries, to heart surgeries, to orthopedic surgeries that could get them back out walking and living life again. And kudos to U.S. News and World Report for calling it out. But next year, they need to incorporate it into the overall rankings and lift up places like Oklahoma University Health, places like Eskenazi Health, where I work in Indianapolis, who actually serve populations that represent the surrounding demographics.
Go ahead.
Well, I was going to say, Dr. Adams, one way to close this gap is on the hospital side, but also on the patient side. Another finding from the study was that even Black residents who have insurance are less likely to get preventative care and then show up with a big issue. How do you address that?
Well, we know that there is a trust gap, and part of that trust gap comes from your workforce. We need to make sure at these big institutions we're recruiting doctors and nurses and other staff that look like the surrounding community. They need to step out and get into the community. I've been to some of these top institutions, Hopkins, Cleveland Clinic, UCLA, and I've challenged them. I said, how come you'll send people around the world to give care, but the people on your campus are scared to go 2 blocks off of the hospital campus and you aren't investing in the surrounding communities? We need to build that trust. People need to know that you care before they care what you know. And these institutions need to show those surrounding communities they care so that they'll feel comfortable coming there.
You know, Dr. Adams, a lot of people have talked about the distrust that some minorities feel when it comes to the healthcare system. But when you read studies that show typically people of color receive care at lower quality hospitals, and that contributes to some of the outcomes that we're talking about that Tony mentioned.
Maybe the mistrust is not all that surprising if the care is lower quality, as the study finds.
Right, exactly. That was my question, Dr. Adams. I mean, is there at least a correlation between that?
There is a correlation, but here's what you need to understand. A lot of times, these big institutions, they get big donations. They take care of more people who have commercial paying because they're put on these U.S. News and World Report top rankings. And the hospitals out there that are taking care of the Black and brown people, they're getting less funding. They're less able to recruit staff. They have worse staff to patient ratios. And it ends up being a cycle, a self-perpetuating cycle. So we need to invest in these hospitals that are taking care of Black and brown people, and we need to challenge these hospitals that aren't to do better.
Dr. Jerome Adams, thank you very, very much as always. We appreciate it.
Thank you. Get vaccinated, vaccines.gov.
Good advice. Thank you, doctor.